Now we'll see the nature of work during MS, DNB and Diploma.
So now regarding your postgraduate period, so basically you are called as a postgraduate resident. So it means that you are going to pursue your postgraduate specialty for the upcoming tenure of period. If it is an MDMS, it is for 3 years, DNB 3 years as well, and diploma 2 years. So during this period, you will be working in that concerned specialty in that hospital for the concerned time or the period which has been allotted to you by the department. So regarding this, because you are called a resident, it means you need to be staying near to the hospital. It should be available to the hospital whenever the work is needed in the hospital. So based on this as well, people are very much afraid that their postgraduate course is going to be hectic. Yes, it will be a busy schedule, but because over the period of time, this is the most important and the most valuable time of your life, where you are going to acquire the skill over this 3 years of your postgraduate training. So here I would like to highlight two words here. Those are postgraduate training and postgraduate residency. So you are getting trained being a resident in that concerned specialty. So giving the most of your time for your concerned specialty over these 3 years will help you have a better skill and a great career prospects in your future as well. Because over the years, due to the stress in the postgraduate period, government has also introduced few guidelines regarding the number of hours or number of working hours a postgraduate resident should have. Those are all there, but because if you have taken the subject with an interest, please try to give your full time for the concerned specialty. You will come out emerging as a successful specialist in that concerned subject. And in your postgraduate period, if you are into a surgical specialty, hands-on matters the most. So it is also equally important how many surgical cases you are operating or you are assisting or you are observing. So with the recent trends in the surgical aspects, you do have recent advances like laparoscopic surgeries, laser surgeries as well. Based on that, if your institute is offering a laparoscopic surgery or laser surgery, please go forward and learn those skills, because they are the need of the hour and they are the emerging trends in the field of surgical specialties. So basically, you are already an MBBS doctor, you know the basics. Now you are going to master the specialty over the 3 years period of time. But you should always keep in the mind that this is not the end of the learning the skill. Learning a skill is over a period of time, but this forms a basis and the foundation for your specialty training. Coming to the academics in your postgraduate training period, it plays an important role. So if you are in an institute where there are good academics, the passing percentage of the institute will be high, and as well you will be doing a lot of work in the research as well. So it also plays an important role in your postgraduate training period.
Yeah, so again, there is a lot of changing minds between MD/MS and DNB, like MD General Medicine and DNB General Medicine. What are the basic differences? We should keep in mind that MD General Medicine is offered by a medical college and DNB General Medicine is offered by a corporate hospital or a district hospital. General Medicine may have bond, may not have bond depending upon the state. But DNB does not have a bond except in district hospitals. District hospitals have bond based on the states. Now, what are the hands-on experiences that we take practical difficulties if we say? In MD, the amount of patient flow, let's say in government hospitals, are much better peripheral medical colleges in MD. But if you see in DNB, central institutes like metro cities, the patient hands-on is also more and the patient exposure is also more. Whereas if we talk about the equipment, the infrastructure, the following of the new guidelines, the protocols, all these things are much better followed as comparatively in DNB hospitals than that of the MD or MS colleges. The person who's doing DNB will have a better experience with the new equipments than that of an MD general medicine guy. So these are the basic differences.
The workload in MSMD is very high, has already been discussed. And also in MSMD, in a government setting, there will be specific units. You will work as a group of doctors, and hands-on also is very good in MSMD. Parallelly, in DNB, you'll work under a specific consultant. Same. Under the consultants, you will see the OP cases, you will follow up the patients. If you're going to follow up 2 patients per day, it will be the whole list of patients detail you will get to know. The only difference I feel between MSMD in a government hospital and a DNB is that you will get from A to Z data of the patients, and you will know what happens to the patient over the 3 years course. And regarding the equipments, in DNB, in nuclear medicine. I have seen a parallel batch, even AIMS MD nuclear medicine. My parallel batch does have not seen proper nuclear scans in their department. Parallelly, in my hospital, where there is a nuclear medicine department, I have seen all the nuclear scans available in world, and also the different radionuclear therapies available, which the parallel even AIMS people have never seen. So it has, everything has its up and down. So the best way to go about how is the workload is you have to go sit, talk to the residents and find out how is the branch there in a particular branch in the particular institution. Regarding the nature of work in each institute, for example, hands-on is very good in MD-MS government hospital because the caseload is very high. Comparatively in DNB, there is more equipments available, upgraded to the latest technique because it's a corporate hospital. So the aspirants will be exposed to more advanced technologies. At least they will observe more advanced technologies than their counterpart in MSMD in a government hospital. Regarding the management, as the caseload is high, it is not possibly feasible in a government settings to follow up the patients till the end. Compared to the DNB, where we will get to know A to Z till the end of what is happening to the patient in the hospital. For follow up is very good in such care. Regarding the treatment quality, both are same. One pros of this DNB is upgraded to early advancement, and DNB will particularly stick to the protocols. And also in DNB, there is a board which continuously will monitor the hospital settings, whether they are feasible for continuation of this education program for the students. Regarding the work nature is the same. In DNB, we work under a particular consultant. So it will be like we'll follow through how the consultants work in a private hospital. We can get steps, advice from them to how practice in a medical field, how practice is in the open public field.